All right, welcome everybody. Before we get started, I just wanted to introduce somebody, Mr. Roger Sparks. Roger is a veteran who served our country for 25 years in Special Forces and has done 3,000 halo drops. If you don't know what that is, it's jumping out of a plane at ridiculously high altitude where you need oxygen, and you basically fly to your destination and then pull your chute at the end. Very, very, probably the most dangerous way to skydive, right?
Yeah, I mean, everything can be normalized. I mean, driving out here is pretty dangerous.
Yeah, that's true. Roger flew down from Alaska to shoot a documentary with us. Tell me if I get this right. The journey of our veterans to try to get their health back after serving our country for so long and doing so many crazy things to your body to help us. And that brought you into alternative healthcare and chiropractic. And then we agreed to have them come here and shoot a series, which we did all week, and they're doing their final shots right now. I just wanted Roger to speak to you for a few minutes because he's very articulate, very, very interesting person to listen to, and I just wanted him to address you guys.
That was very kind, Mike. I feel very privileged to be able to speak with you guys today. You guys are a very impressive group of healers and facilitators, and what you're doing is pretty amazing. Like Mike mentioned, I spent 25 years in the military. The majority of that was within special operations. I've seen it all. A lot of my friends were injured or killed in combat. As I left service, many of my peers had traumatic brain injuries, a lot of guys missing limbs, a lot of explosions and gunshot wounds and stuff like that. I wanted to try to figure out how to heal myself and heal them and try to figure out how to be the vanguard to lead the way towards what health and vitality is after experiencing all those different things. Because there is life after service, even after 25 years of such surreal experiences. And that led me on this journey. We developed a series called Backbone because I believe combat veterans are the backbone of this country. We owe them a better healthcare service, and that led me into trying to find what homeopathic or holistic health modalities are out there. And of course, one of the first things that we ran into was chiropractic. That led us to Mike and Colleen and AMI, kind of like that spearhead of what integrative medicine is and can be. Like I said, I'm just really proud to be here and be a part of what you guys are doing. Thank you for your time and support. Really appreciate it.
Thank you.
Hello.
Hey, how you doing?
Good, how are you?
Good.
How may I help you?
I'm here to check in. My name is Roger Sparks.
Okay, my name is Tiara. It's nice to meet you.
Nice to meet you.
So we have some water, tea, and coffee over to your right if you're thirsty, but you can sit anywhere you'd like and I'll be out shortly with some paperwork for you.
Sounds good.
Part of the uniqueness of the AMI system is we took that concept of a team with different disciplines and took it to an outpatient setting. When we started, didn't exist very much. There was very isolated professionals that would refer to each other, but not work in the same facility on a team together for a patient, put all the disciplines together to have the best patient outcome.
Yeah.
I remember I was at her family, which is very pharmaceutically oriented, and I said, I'm going to go to a chiropractor. And they were like, they're not real doctors. That's the last person you want to go to. I'm like, well, I'm tired of doing what I'm doing, and I'm just going to try it out. I know a guy. He just started his practice. I'm sure he won't hurt me. She went with me to protect me. And he looked at the same x-rays as the hospital, and he's like, yeah, you have a straight neck, but you also have degeneration at 2 levels in your neck, to your arm and to your head. And I had been suffering with headaches for like years. And I was like, crap, I wonder if that has anything to do with it. When he started working on me, not only did the injury heal up, not only did my ability to use my hands come back 100%, but the headaches went away. And I was like, holy crap, this is what I'm supposed to do in life. There was no going back after that.
So I have your paperwork for you. I'm just going to briefly explain it just in case you have any questions. So this is basic information about yourself up at the top. This is called assignment of benefits. That just states if you were to proceed with treatment with us, you're solely responsible, and they'll go ahead and give you your options before you agree to anything. This next page is your main complaint up at the top. If you have more than one, feel free to list as many as you need. And then past medical history, you'll answer yes or no. Medications that you take, and if you have a list, I can make a copy for you. And then any allergies that you may have. This right here is a more recent survey. So you'll just select 1 through 5, rating each of these items on how often they occur, because we want to know what's particular to you. And then on this last page, this is just our consents page. So consent for communication is up at the top, however you want to be contacted. Consent for us to treat you, and then acknowledgement of HIPAA. Do you have your driver's license and your insurance card so you can make copies?
Yes.
Perfect. Thank you, and here you are.
All right, thank you.
Let me know if you have any questions, okay?
Okay, thank you.
So I became driven, and I quit my job against everybody's advice except for hers. Everybody in my life was saying, don't quit your job, you have a great job, you're crazy. I went to school, I had to go back for 6 years. I already had a 4-year degree. I got my chiropractic license and I opened up a practice in '92. By '95, I had like the second largest practice in the state of Pennsylvania. I was just driven. And we got up to about 700 visits a week, which is phenomenal for a chiropractic office. Usually they do like 100 or 150. I started noticing there was something missing. I'm getting these people well. They're saying they're having miracles happen. It's phenomenal for them, but I thought we could do more. And I started looking at her. And I started looking at her background, and we should work together. We created a rehab program, PT and chiropractic working together. You never see that. And the state of Pennsylvania said to her, if you accept a referral from your husband and you treat the patient, you're going to lose your license because we don't recognize chiropractic referral. We're like, what? So
Yeah, crazy. We realized that with the medical license, bringing a medical practitioner on, with the medical license, I could take a referral from a medical person. Even more importantly was that our patients wanted more from us and we couldn't deliver more. We could deliver chiropractic care and rehabilitation, but by bringing the medical component on, we could deliver more without drugs and surgery, without a prescription, under one roof. Our idea was to bring the team into place. Because even when I worked in the hospital system, it was always prescription and surgery. That was the first line of defense. So that's where that idea was born.
Hi, Roger.
Hi, how you doing?
Hi, I'm Bristy. So nice to meet you.
Nice to meet you.
I'm one of the case managers here, and my job is to learn a little bit more about your symptoms and how that's affecting your quality of life.
Sounds good.
Okay. Can you tell me a little bit more about the journey that you've been on with your health and how these problems started for you?
At 15 years old, prime adolescence, I had a lot of knee pain. The doctor that I was seeing basically told me you have a tumor in your knee, and I had to have a surgery within the same week. They didn't know if it was cancerous or not.
Oh my goodness.
I remember the doctor telling me, he's like 50-50, you're gonna lose a leg, but 100% you're never gonna run again. You're never gonna be normal. This is gonna affect you very severely. But it was a golf ball sized tumor. It had eaten away my MCL into the bone of my knee. It was a pretty invasive thing that they did. I didn't have cancer, it was a benign tumor.
That's great.
But they did replace my MCL with a cadaver MCL. Joined the Marine Corps, went in the infantry, and then tried out for Marine Special Forces, which is Marine Reconnaissance, and did 10 years as a Marine Reconnaissance. So just overuse injuries. My next significant history was about 16 years ago. I had a severe back injury that left me paralyzed.
Oh my goodness.
And it wasn't a herniation, it was disc fragmentation, from trauma. But in 2010, I saw very severe combat. We were overrun, we called in airstrikes on ourselves. I was exposed to like overwhelming RPG percussion or just Hellfire missiles, hitting at our location. And so the amount of barrow trauma from that, let alone just the psychic event of surviving the mortality of it, that was a very significant event in my career that I know I was affected with traumatic brain injury from just overblast.
Yeah,
and then a lot of grief issues from like surviving that as well. And of course, PTSD and traumatic brain injury, the symptoms are very intermingled. I fought to keep doing my job, and I think I did it for another 5 or 6 years after that.
Wow.
But yes.
You have definitely been through a lot of trauma, but again, that's a huge testament to you and your willpower and your dedication to the country.
As I get older now, it's more of like a spinal stenosis. Just the wear and tear and the degeneration is kind of catching up with me. Over the past year or so, I've been noticing like this systemic, like inflammatory stuff that just creeps up, and I'm trying to do everything holistically possible.
Well, think of the amount of trauma you've had to your body. This process, once you've had this much trauma, all of those little micro traumas creating that degeneration throughout your body, that has to be caught. Got to try to prevent that from progressing. We have a fully medically integrated team that is not just focused on getting you out of pain. Yes, that's a huge plus, but it's focused on restoring your function and your quality of life. We have to identify all those sources of inflammation. You now feel inflammation throughout the entire body. If we just start picking pieces of the puzzle, just because you have a symptom here, you have a symptom there, we're only going to get so far in creating a long-term solution. We have to be very thorough in this, and it does take a team. We have a medical doctor, we have nurse practitioners, we have chiropractors, we have rehab technicians. Everybody works together under one roof to identify the source of the problem so that if we can help a patient, we actually create, again, more of a long-term solution that is focused on giving them their life back. I had never seen myself being so one-on-one and raw with patients. And I remember actually going in with Dr. Carberry one time for a report of findings and seeing the emotion and seeing how incredible it was to see a patient have hope again who had been told that there was nothing else that could be done for them. That was a moment for me to really be like, okay, I have a real chance to make a difference here. Slowly, kind of was taken under Dr. Carberry's wings to really learn how to engage with patients and, how to educate them that there were additional options to healthcare, and it wasn't just about the medications and the surgeries. To start seeing patients come in who were barely functioning and to see them maybe 10, 12 weeks later leave a completely different person, I mean, it was life-changing.
I've been through every kind of health system in the world pretty much. It was a much different approach. It seemed very intimate in the fact that, you were digging and peeling that onion, trying to find out, well, what is this patient's motivating factors?
Absolutely.
Okay, you're only on vitamins and supplements, things like that. That's good. Awesome. You have a self-allergy and no other medication allergies, right? Okay. I just love the fact that I can come in and work here for 9 hours a day and not have to write a single prescription. I mean, not an antibiotic, not anything for a cold, nothing. That is very hard to say when you're a nurse practitioner. That is what my colleagues do all day long. Every hour, at least 10 to 15 prescriptions. We have medical doctors, nurse practitioners, physician's assistants, chiropractors, physical therapists. All of us come together when it comes to a patient, look at the care plan, and all of us have an input of how to treat this patient. We go from there. So it's very important for all of the different team members to be on the same page. They may have different opinions on how to treat the patient, but at the end goal is to get the patient better without using opioids. That's where the integration comes from, is having all the different teams talk about the patient and getting them better. So we work together, physical therapists, medical practitioners, chiropractors, all of us work together to get patients off prescription drugs and out of surgery. But if it's a point where they have to have the surgery, we will always be there after to take care of them for physical therapy after the fact. What we'll do is we'll do full spine x-rays, because I really like to look at the neck and the mid-back, because it's all attached, it's one whole thing, and it's a better way for us to treat you here, is to do the full spine, as well as bilateral knee x-rays. Sounds good? And then we'll bring you back the next day and go over the x-rays with you and let you know what we can do. Okay? Sounds good?
I worked with enough therapists that were like, you need to get it with the reality check with these families and tell them they're never going to be the same, they're never going to wake up, they're never going to do this. And I'm like, how can I rightfully say that? Maybe they will. And they're like, you're too hopeful. And so I thought to myself, it's almost a disservice to have a patient and tell them all the things they're never going to do, right? Why not say, hey, here's all the things you want to do. I'll work side by side with you to get you as close to that as possible. And that's where I think this model, what makes it so amazing, is that we put together teams of people who say to somebody who's lost something in their life that they've wanted to do, whether it's walking with their wife, a golf game with their buddies, it doesn't really matter. It's something that to them is emotional that they lost. And so our team says, we don't know, but let's do an evaluation on you. Let's put together hands-on therapy between chiropractic and rehab, okay? Let's walk the journey together, because I think you can make it. I think to me what makes this so amazingly different is coming out of the traditional healthcare system, there's a lot of be careful, you're sick, you can't do,
don't want to build your hopes up.
Don't build your hopes up.
What's wrong with having hope? What we've discovered with patients is if you give them hope, they probably get a better outcome than if you hold back their hope. Don't want to build your hopes up too high. I go, that's the worst thing a doctor could do. You should build your hopes up. You should say, look, let's try to get you as close to what you want to get to, and let's go for it. I mean, what else you got to lose? And this idea of stimulating the body to reprogram the brain to have it work better is a pathway that most people don't even realize exists. We do have a lot of medical doctors and nurse practitioners come in here every month for training. And when you do that, you get abilities back, and that's why the slogan for this clinic has been for the last 12 years, regain your life. Because that's what we're trying to do. People close doors on things they can't do when they have a limitation in their body, and we say, let's see if we can get it back. Let's put you on a program to find out why you can't do it, fix the function of that joint, strengthen the musculature around it, improve your posture so you can function better, and maybe you can do those things again and regain that part of your life. That's what we're about.
And Western medicine keeps things complicated and such a mystery that the patient is on the outside. So everything is like, there's big words and big complications. That's the mistake, because once a patient realizes that there's a path to be empowered to be in control of their health, they're forever in control of their health. See, whenever they're not in control, they continually return to that same system who keeps them in the dark and gives them something like a medication or surgery, and then they go home worse because they actually have no control over it, okay? And if you don't have control over something, right, you begin to spiral down.
Your marriage is like the perfect marriage when it comes to, integrating chiropractic and Western medicine. The inherent relationship that you guys have just really permeates, your professional careers. So it's definitely what AMI is definitely about, through and through.
That's a really good compliment. I appreciate it.
Yeah, thank you.
He's had a lot of being in the military. He's had a lot of surreal combat experience as well. A lot of things that has, affected his quality of life. But one thing that he's found along the way is keeping himself moving. He's constantly stayed active in the exercise, and that's helped him thus far. But his biggest motivation to see, if there are additional things that can be done to help him is he has a son who has cerebral palsy and is type 1 diabetic, so he is his caretaker, and he's got to be around for him. He's also a tattoo artist, we found out when talking with him, so sitting longer than an hour in those positions, being bent over doing tattoos, that's a big problem for him.
In an integrated model, we're talking about the patient in all aspects of their health to figure out and unravel what do they need to solve the problem. I think it's how healthcare should be. Everybody working together for the benefit of the patient. And that translates a little bit further. The benefit of the patient would also then mean reducing costs to our healthcare system. The definition of healthcare in Merriam-Webster's dictionary is the restoration and maintenance of health. So if you go to the doctor and they're not trying to restore or maintain a state of optimum physical, mental, social well-being, then they're not practicing healthcare, they're practicing sick care.
That's one of the great benefits of that integrative medicine. And these concepts that you and I are talking about are extremely foreign to the common patient that would come in to seek assistance,
For sure.
So it's like if we're reaching anybody with this, just to address this and to get them to question those things within themselves, that's profound, that's powerful stuff.
If you look at the top 2 reasons to be in a hospital, being born is number 1, and back pain is number 2. It's estimated that 9 out of 10 people have a major problem with their spine in their lifetime. 9 out of 10 people. That is the vast majority of the population. That's why our healthcare is so expensive, and it's getting worse. What do? We throw opioids at these people. The number 1 diagnosis that results in an opioid prescription is back pain. When you look at it, the United States consumes 80 to 90% of the world's opioids. We're only 4.2% of the world's population. So 4.2% of the population consumes 80 to 90% of the world's opioids. And what's the number 1 thing it's prescribed for? Back pain. Do you see it? Do you see why we do what we do? Yes. We're trying to actually stop this. Would somebody possibly need an opioid? Possibly. But do they need it the first time they go in with back pain? No. Do they need it when they have a skateboard injury and hurt their ankle? Probably not. Do they need it when they have a tooth pulled? Trust me, having a tooth pulled is not the most fun thing to do, but I don't want to become a heroin addict to get out of the pain of having a tooth pulled. You build a tolerance to the pain medication. So if 1 pill does the trick, after a while you got to start taking 2 pills. And then if that does the trick, after a while you got to start taking 3 pills, because your body recognizes pain is not a bad thing necessarily. Pain is what your body uses to alert you that something's wrong, number 1. And number 2, it's usually the side effect of healing. So if you're going to do everything to stop the pain, you'll eventually stop the fixing. Anti-inflammatories. Is inflammation a good thing or a bad thing? Good thing. Well, it can be both. It can be out of control. It's like a fire. A fire in your furnace can heat your house or burn your house down. If it's out of control, it burns your house down. What happens is, we've been taught inflammation is a bad thing. If you have inflammation, you should take a pill. It's called an anti-inflammatory. And that stops the healing process, but you don't have as much pain. I don't know about you, I'd rather just go through the pain. This is also another fact. The less pain medication you take, the higher your tolerance to pain is. The more pain medication you take, the lower your tolerance to pain is. and therefore in the future you'll need more pain medication. Does that make sense? Yes. We're just looking at it wrong. We're focused too much on the symptoms. Look at drug overdose rate, death rate in the world. These results you get when you start looking at health as the elimination of a symptom. You go, why do doctors do this? Or the doctors must be evil. No, the doctors get into healthcare. My experience has been that medical people get into healthcare just like chiropractors for the same reason. 80% of us genuinely wanted to help people. 20% we just stay away from. The reason the medical doctors do this is they're forced into what's called the standard of care. How do you control the doctors? You have a board that sets the standard of care, and the standard of care always leads to a drug. So when they surveyed doctors in the Wall Street Journal in August of 2014, and they asked 12,000 family practitioners, do you like your job? Would you do it again? Would you recommend it for your kids? 94% said, absolutely not. It's so bad now that they can't even fill classrooms in medical schools for people who want to be family practitioners or internal medicine doctors, because their fathers and mothers who are internal medicine doctors won't let them do it. There's a major shortage. We've lost about 200,000 medical doctors in our medical population, not from dying off, but from quitting their job in the last 30 years because they're disgusted with it. So we can make a huge impact on healthcare by doing our service. And sure, we got to see the person for 7 weeks, 8 weeks, 9 weeks, 10 weeks, 12 weeks, whatever it takes, but we're helping them avoid a surgery. And the cost for our program is a fraction of what the surgery would cost. And if what we did was done across the country, you would see those statistics of the cost of healthcare of Americans come way down and the life expectancy go way up. And what we're doing is we're not investing in a lot of equipment to be in here, we're investing in the people who treat. That's why we do so much training. All different disciplines, nurse practitioner, medical doctors, physical therapists, chiropractors, all working together with a common cause of improving the function of this patient's body so they don't go through this process and end up going under the knife and then having to repeat that process over and over again and then giving opioids and saying, well, you might as well take this to feel better. I mean, it's like such a bad dead end. We're trying to get them off that street. Does that all make sense? We're trying to stop the opioids and avoid the surgery. And we're very, very, very successful at it.
So Roger, we have some good news. We can absolutely help you. Dr. Neuber will go over the x-rays with you, and then I will do my recommendations.
Sounds good.
So we're going to start here at the cervical spine, and then we'll work our way down. Looking from the side, we see a nice C-shaped curve here. That's exactly what we want. The head is shifted a little bit forward, but that's okay. Some rehab and exercises can bring that right over your shoulders. Individually, these disc spaces all look nice and wide and healthy. That's good. That shows that those discs that occupy that space are probably nice and hydrated and working well. The only spots I'm seeing are back here through these facet joints. There's a little bit of osteoarthritis, so that could be contributing to some of the stiffness in your neck, maybe some pain every once in a while that you feel going on there. But nothing too severe in the neck, which is good. Looking head on, you see just a little lean over to the right. Overall though, not dramatic. We're really checking joints throughout here. They all look relatively clean, nothing poking out at me that's really, this is an issue. Moving down to your thoracic spine. So this is looking head on, right? Lung, there's your heart. Those all look nice and clear, that's good. We're just really looking for nice straight spine, which you have in this position. Also, this curvature is pretty good. I like the curve. A couple small areas where there might be some bone spurs starting. That just shows that that area is stressed. It's been stressed for quite some time if those bone spurs are starting. Just like a bodybuilder kind of exercises his muscles and it's stressing his muscles and they grow. If the bone is stressed, it'll start to grow. So that's why we get bone spurs. You know, just making sure that this area is moving, you know, through adjustments, exercise, different rehabilitation, we can make sure that that kind of process stops. Going farther down, a little bit of a scoliosis, okay? You can see that little curvature. This is the L5-S1 disc. This should be the biggest disc in your body, okay? But it is significantly decreased. That is probably where a lot of that pain is coming from, aside from some arthritis going on in these joints, okay? The nerves that come out of your lumbar spine and out of your spinal cord have to pass through these holes. And you can see that hole isn't as open as it should be in that area due to that loss of disc space and some of the arthritis in the facet joints. Different pains, different numbness, tingling, anything you might get in your legs, probably coming from that. So making sure that that area is moving and that the muscles around it are working as well as they can is gonna get you out of that, okay? Your knees, being in the military, probably taken quite a beating over the years, right? They look pretty good as far as the joint space is concerned. We want it nice and even throughout. Okay, so the joint space in the anterior to posterior is very good, nice and even throughout both sides. A little sclerosis through here, but that can be normal. It can be an indication of osteoarthritis. Here on the lateral view, we can see that actually your patella has some arthritic changes to it. Okay, you notice here how it kind of comes to a sharpened point. That's a little bit of a bone spur at the top of the patella. That patella has to slide through a groove, and when you're marching and doing things like you've done over time, that can lead to wear and tear. And so some of the cartilage along the patellar surface or even the femur is probably taking a beating and probably a little degenerated, which is why now we're seeing bony changes like we're seeing on the kneecap, okay? It's not as severe on the right, but it's definitely underway, the same process. Making sure that the biomechanics of the knee are functioning as well as possible, and then using some of the other treatment options that Bensie's going to explain are going to go a long way in helping you deal with that. And you can see here, same kind of sharpness towards the top, just not as severe. Okay, so those are your x-rays. Do you have any questions specifically about the films?
You know, my main question is, I'm sure what we're going to get into next is like, well, what are things that I can do to improve my function, both with my L5-S1 space and then with my knees? You know, I mean, it's been a lifelong thing, so I know the problem's not going to go away overnight, you know.
Yeah, you know, it is a lot of wear and tear over the years, so we are trying to play catch up with that. Some of the rehab and exercises will help address different muscular imbalance issues that have been going on for some time that'll also stop this from progressing any further. And we're going to discuss all of that and come up with a more specific plan through different functional exam and things like that we're going to do later on in your care, okay?
Gotcha.
My recommendations for you, based off what we saw today, 30 visits of rehabilitation visits, 30 of chiropractic care, trigger point injections, and some PRP in both your knees. Alongside, we're going to do a range of motion test on you on all of the areas that we discussed and a functional exam. Alongside that, we'll have some knee braces, back braces, and posture brace for you.
Maintenance is key. We really do our best to try to keep you progressing. So even after we've discharged you, because we've got you pretty close to those functional goals that you want to achieve, of course, you're going to continue doing a lot of the exercises we've prescribed you on your own terms, but we are confident that we can get you where you need to be if you stick with this protocol. We're going to give you an at-home care plan, and then we have you come back once a month for a maintenance adjustment and just keeping things where it's at, okay?
So we're going to go from the executive offices to the operations. So operations is actually the area where we coach our clients, and our clients are two different levels. We have our core program, which is new clients. A lot of times it's chiropractors, sometimes it's medical doctors, sometimes it's physical therapists, but mostly it's chiropractors. And then we have our advanced group called the Strategic Business Unit, and they're much higher level people dealing with our clients who've gotten measurement of success. When you're running a $500,000 clinic, you have certain problems. When you're running a $5 million clinic, you have totally different problems. So our coaches in the SBU are usually of a higher level. They have specialties with operations, marketing, finance, human resources, and training for clients. So I'll show you all that now. Okay, so I'm going to introduce you to Dr. Paul Kuva. Dr. Kuva is in charge of our core coaching program for new guys that come into our AMI's program to learn our systems.
We help chiropractic offices convert to becoming physical medicine medical practices. And that doesn't mean they're giving up chiropractic, but they're adding additional services that are non-narcotic and non-surgical based services to help people recover from a variety of different physical problems, particularly low back pain, neck pain, knee pain, and other associated degenerative arthritides. We make certain that they're able to deliver in a space of what would be called early adoption. There are regenerative medicine procedures, human cellular tissue products, otherwise known, some folks know them as stem cells, but they're actually more than that. There's viscosupplementation that goes on, and trigger point injections and everything else that helps a standard chiropractic office, which would be delivering chiropractic care, now bridge into the area of physical medicine practice, offering additional services which are non-narcotic, non-surgical based solutions to help patients that are suffering from a variety of different physical conditions. It's an early adoption of specific healthcare technology. We're actually moving forward at such a pace that, science of the whole thing is just starting to blossom. It's just starting to come to life.
So Roger, this is Stephanie Silva. She's the head of operations of our SBU, that's called our Strategic Business Unit.
With our team, we have 5 pillars. So I'm operations, we also have a marketing manager, finance manager, professional development, and human resources manager. And we're working with our top tier clients who've already transitioned over to us to really deep dive and give them business processes so we can start looking at expansion and really improving our healthcare system.
We want to get our model out to as many businesses as possible. What you saw on the other side with the core team, they're working with our guys who are relatively new to introduce the idea of change. Once they get the model basically in place, these guys are helping them to streamline from the business systems to how they can expand to be a bigger presence and open more clinics. And actually, we're just trying to get more people to experience on a grassroots level what this type of care does, so that with that attention, we can actually make a grassroots change in healthcare. So these guys are reaching out to try to enlighten people about what we do so they can get more doctors involved. It gives you an idea of some of the places where we have clinics set up in the country.
Nice.
We're in 46 states. And then here's more of our sales team. Hard at work. So I'll go over and show you this team here that assists our vendors in getting connected with our doctors so they can help them with different things like products and marketing and services like that. That's the team here. This is our marketing team. These are the guys who are responsible to keep us in front of the public so that they're more aware of what we do and more doctors reach out and put the program into their practice.
Gotcha.
And that quote says it all. The AMI challenges the status quo of healthcare because we believe that the power of healing starts within the individual.
Our client position in starting with us is they want to provide the best care for the patient, and Mike and Colleen put the systems together that the doctors can actually implement. And then we have trainings in the facilities of Chattanooga, Tennessee, to train our doctors in person, and then we follow up with Zoom calls, et cetera, to keep them inspired and to help the patients.
I mean, I'm just really impressed, not only witnessing the training that you guys were doing there in Chattanooga, but what you guys have here. And it's really that missing piece is what makes AMI so special, is that scalability, to that integrative practice model from what I've seen.
Yeah. Our mission is to change healthcare, to become less focused on drugs and surgery and more of a natural earlier steps, which are skipped a lot in healthcare.
Yeah, what initially attracted you guys to Mike and Colleen?
What was the attraction, guys?
Initially, when I first discovered about their model, I was opposed to it because I had a very principled practice when I had my practice. And the idea of having medical in there, the first thing that popped in my mind was, well, I've been the opposite of that in my practice. I want to be able to provide a holistic, natural way for people to provide care. And then when I actually read what it was about, it was actually to help people avoid surgery, to find a natural approach to support the longevity of their lives. And I was like, this is like the perfect model.
It seems like you guys are really trying to find all the vanguards within those industries to help, spearhead what you guys are doing.
Right now, I think it's been the Wild West, in particular with stem cell, and because there's been a lot of different players in that market, trying to differentiate what we do. Our core foundation is physical medicine, and being able to incorporate solid procedures that help the patient get well, and that maybe is one facet of it that can help. But helping guys realize they need to have the foundation in place and they'll always be able to help their community, regardless of even this age of COVID.
It's been a challenge, but it's been an exciting challenge because we're, light years ahead of where we were years ago. We can see that we're going to make a huge impact. We can see the end of it. We can see where we're going to reach to in the very near future, and we're already getting there, as you saw today, with all the different things we have going on at the same time here.
We started with zero money. We all threw, I don't know, like $100 in the pot. I mean, there was probably a few more dollars than that, but that was it. It was sheer, like, roll up the sleeves, and all of us did it for a good year and a half, 2 years of that we started from zero money, just our sheer drive, and we got it standing, and then we grew. And we actually, about a year and a half ago, caught the eyes of Brandon Dawson and Grant Cardone. They were even amazed in the space that we're in, what we were able to build in this space.
From the very beginning, we had to change the way we thought. First I thought it was, as a chiropractor, it was me against the medical system, and I realized I'm not going to change healthcare doing that. It has to be me with the medical system. Aligning with them, that has been a difficult thing for me, and I can see that struggle with our clients as well. A lot of times they have to realize, you have to let some control go to grow, and that's true. And that has been a big struggle for me and for a lot of our clients. Every aspect of growth you run into, you're going to run into barriers you've never had before, and you have to be smart enough to figure them out and figure out the way to do it. You have to enlist the help of others, which was a hard thing for me to do. Enlist the help of others so that I could use their expertise and their knowledge to overcome a lot of the barriers that I was not familiar with. And I've recognized over the years that every time you want to grow into something, to make that big goal, like the big goal we have is to change healthcare, you have to do it on a gradient. If we go too fast, we just run right in and get it, we leave the patient behind. And if we leave the patient behind, we leave the doctor behind, and we leave the staff behind. So the gradient has to be applied not only to us, but also to the end user, the patient, to the staff of the doctor who's the client, and all of his clinical staff that he's going to expand. They all have to be able to buy into this. So everything we do has to be on the right gradient so people understand why it is. And at the end of the day, when we finally reach our goal, it's the same thing with the country.
They want to take us now. We have a clear line of sight that we actually can change healthcare. We see it, it's there at this point.
But it seems like you guys have created a model that this can sustain itself forward. I mean, the bulk of what you guys are doing, beyond the patient, which is remarkable, but to educate the providers to then carry this on further, and it just scales itself out and continues to grow. We're
never going to try to eliminate surgery or medication because we're going to need that, and there's been a lot of great things that came from that, but just the volume that we do, we think that's excessive. So if we are successful at what we do, it will lessen those other types of procedures, which will lessen the burden on healthcare and on the country.
Thanks for being a part of what we're doing here with Backbone, but thanks for giving me hope. Not only for myself, but the medical community.
Yeah.
Thank you. Thank you for including us.